Start from the first question itself. So the question is, what would be the name of your biography if ever it's written? So yeah, you could just have some word in your mind, and then we can discuss one by one. Just give me a second. I'll just come. Just give me a second. That if you can switch on your camera at least while answering, so it will make it more interactive. And plus, you can just ask about your camera quality as well, right? And it will help you to have a eye contact during the interviews. Yeah. So yeah, we can just begin with the first question. What would be the one word? What would be the title, or what would be the name of your biography if it's ever written? So anybody wants to answer? Like it's just a word. Yeah, Dr. Hari, you want to answer?
If I'm ever
Anybody?
written a biography, if I
Yeah,
were
if you're
writing a biography,
yeah, go ahead. I think your voice is breaking. So audible?
देखो 20 किलो हुँदाखेरि त्यो ब्याग जोखेर त्यो निकाल्न पठायो सामान क्या
ए हो
उही मैले हेरेको।
Anybody wants to answer what would be the name of your biography? Like if ever given a chance, the name of my biography would be extravagant or dynamic. Like I would use that word if a biography is ever made on me. Anybody else wants to go with the answer?
Yeah, I want to try.
Yeah, go ahead, Doc.
This is an interesting question. I will call my biography book The Transition because for me, I believe this is the most challenging part for every human being is when you're transiting from one state to another. For example, for us other doctors, it's the hardest part is when we're transiting from medical students to be working as a doctors who can provide for their families and for their patients. That's why, because I faced many challenges, I think my biography book will inspire and help people from my experiences.
Okay, perfect. So what would be the name of your biography?
The transition, that's it.
Okay, transition. Okay, perfect. Perfect. So anybody else, Harshita? Do you have an answer to this?
Yes, can I do try?
Yeah, go ahead, Dr. Khulud. Yeah, go ahead.
Yes, I can. Thank you so much for the question. I can name it as Beauty Abundant. So I think I find myself like for my background and medical practice in my country and in US, I love to help others, and I love to see the people happy and living their good moments all the time. Yeah,
Sorry, what would be the name of biography?
it's a Beauty Abundant.
Beauty Abundant. Okay,
Yes.
perfect. Yeah, that's a good answer. Anybody else? You can just give your thoughts. No answer is going to be wrong. Every answer is correct.
Hi.
Yeah.
Yeah, so I'd like to try to answer for this one. So I think I put my biography titled as The Happy Soul because I personally believe that I want to try out any new adventure or any new thing, I always love to try it. So, and on the whole, I believe that being happy is a part of the whole process. It's not just achieving what I want and then I'll be happy, but I always feel it's a personal thing. So, if given an opportunity, I definitely like to name it as a happy soul.
Perfect. That's a very, very good answer. Yeah. Anybody else wants to try, Doctor? If somebody is
I
told in
can
the
try.
chat.
I have three.
Yeah, go ahead.
Three in
Go
mind.
ahead.
I don't know will it work or not, but you guys can suggest for it. By the way, hi everyone.
Go ahead.
Nice meeting you all again. So the first I think is like this shall too pass, because I had a very difficult time. So I was thinking one, if it's on a serious note. Another I'm thinking is the Leoness. Like I'm a Leo by star, so the Leoness, like. And
biography would be Voyage. I think it's just the journey to USMLE, journey to medical school, and yeah, something along those lines.
So yeah, that's a very, very good answer. Voyage is a very good, I think, name. But yeah, you cannot just don't say that it's a USMLE journey. Just say the journey of life. That I have seen a lot of ups and downs in my life. But yeah, when I was having low points, I just passed them somehow, and I have reached wherever I am so far. So yeah, otherwise, Voyage is a very, very good
Yeah.
answer. Yeah.
Can I answer,
Go ahead.
please?
Sure, go ahead, Dr. Alia. Yeah, then we go with Dr.
Okay, I would name my biography as Commitment, because from the early beginning of my life, I feel committed to the community where I live. I believe that my God granted me a lot of abilities and knowledge, and I feel that I owe my community and my the people around me a lot. I feel that wherever I live, I have to use these blessings to help others, and I believe that medical knowledge and this clinical skills are great blessings that can help people anywhere.
Yes.
That's why, as long as I did this in my home country, this is what I want to do for the people around me here in my new home, the USA. And thank you for asking me this question.
Perfect answer. Yeah, that's a very, very good answer. Yeah.
I would like to go next.
Yeah, but just a second, we'll go with Dr. Lisa, then we can shift to Dr.
Okay.
Priyansh. Is that okay? Yeah, Dr. Lisa,
Yeah,
go
yeah.
ahead.
I would like to name my biography One Step at a Time, since I'm not a multitasker and there are too many things going on. So at times I put too much things on my plate, which can get overwhelming. So I would like to take a slow progress with determination and patience, so that I can um, complete my things and I can complete my dreams. So it would be one step at a time.
Perfect. Yeah. Yeah, Dr. Priyansh, go ahead with your answer.
So I would like to name my biography as I didn't come this far to only come this far, because other than, as you all know, in the USMLE journey, there are some stops where you all hit dead ends, where you feel like you're not progressing forward for months. And apart from USMLE journey, I've been on some other journeys like calisthenic journey and weight loss journey, where I've also hit dead ends. So through all of my journeys, the one statement that has been with me is the statement that I didn't come this far to only come this far. So that's what I would like to go with.
So your title is very good, but just a little suggestion.
Mhm.
That since you're talking about the biography, that should be associated with your life. Don't just reduce it to a USMLE journey, or just talk about in general that at times we don't feel up any like there is no progress in our life, and we just feel that there is a halt, right? But yeah, I just overthink that somehow. Just don't reduce it to USMLE, because it's just a very small aspect of your life, right? Like maybe once you get
Yes.
matched, then this will be just a very small aspect of your life, right? It's right now
Yes.
it's a big aspect because we haven't matched yet. So just yeah. Otherwise, when they are the why, that's just a suggestion. That's what I feel. Otherwise, your answer is very
Yes.
good.
Yes. Thank you.
Yeah. Perfect. Yeah, Dr. Sameer, I think you are here. Do you want to answer the question?
I have not thought about it yet. I'll just think for a while. Thanks, Ayushman.
Okay, perfect. Anybody else wants to go with the answer? Dr. Lisa, you want to say something? Anybody else? Just give. Even the all answers are perfect. Like you people have such a good ideas in your mind. You can just go ahead with your answers. Dr. Nikhil, you want to answer anything? Or the
I
next
have not yet
question
thought
is
about
like,
it. I have not yet thought about it.
just if someone, maybe just imagine, maybe it's an interview day, right? They ask you a random question like this. So what would be your response?
Yes.
Because it can happen. Like we can have some impromptu questions that we don't have an answer to, right? So what would be
Well,
your answer if they ask you? It's fine. You don't need to have fancy terms for your biography or something.
just let me think about it for a while and I'll answer it definitely.
Can I
Okay,
suggest another one?
Yeah,
please go ahead.
Yeah. So I would name the biography as The Light at the End of the Tunnel. Because we all know that through all the dark times in our life, every dark time has an end, and we see the light at the end. So
That's a good answer. Yeah, Dr.
Yeah,
Mail, you want to
I would
answer?
like to title it the resilient and sorry. Yeah, please go ahead.
Dr. Smith, go ahead with your answer. I think somebody's mic was unmute. I'll mute them. Just go ahead with your answer.
Okay.
Then we'll go with Dr.
Thanks,
Ashish.
Yeah, I would title it the resilient and unfinished warrior, because there have been times when I've thought things might have ended. In my life, some paths might have been closed forever, including this USMLE path. And but my resilience is something that took me forward, and resilience is something that I believe is essential even during residency as well, because we'll encounter some tough moments. So eventually, this resilience will take me forward in my life throughout till the last breath. So that's why I would like to title it the resilient and unfinished warrior.
Answer. Yeah, Dr. Ashish, go ahead with your answer. Then we'll go with Dr. Lakshmi.
Hello, everyone. It's nice to meet you all. Thank you, Ashwan, for hosting this meeting. So, for my autobiography book, I'll name it Turning Pages, as it will highlight my journey of life and how I overcame all the challenges throughout my life and how I became the person who I am today. Thank you.
So, yeah. Can you just repeat the name again, Dr. Ashish?
It's Turning Pages, like the pages of the book.
You all have like amazing ideas. So yeah, that's a good name again. Yeah, Dr. Lakshmi, go ahead with your answer.
Hi everybody. Thank you for giving this wonderful question. If I were to write a biography about myself, I would title it as Finding Me, because throughout my life, I have been posed with different situations and different challenges in life, and every time I have faced those, I have kind of realized the person that it has made me, and it even surprised me many times. So I've seen personal growth that made me realize what kind of person I am. So hence my title would be Finding Me.
That's a good. Perfect. Yeah. So just like we'll just take the few more answers, and after that we can just shift to the second question. That if you want to, if you ever had a conflict with your colleague, that could be your attending HOD, even your some like even nurses or anybody else in your this medical settings. So yeah, then our next question would be that. So you can just even think about that answer as well. The ones who want to answer that question. Yeah, Dr. Smart.
Hello, everyone. I will name my biography as Purpose, because what I have learned, what I'm learning, and what I will learn, the purpose of us being as humans on Earth. So that's what I will name it as, Purpose.
That's a good answer. Yeah. Anybody else wants to answer before we shift to the next question? Yeah, Dr. Ayat, please go ahead with your answer.
Hello all. I guess I have two titles. The first of them would be the eagle. I see the eagle as a bird that always looks around and it knows where the goal is and is strict to it. And yeah, I guess that's it for the eagle. The other one would be the coffee. Coffee is an integral part of my daily life. Coffee marks my day, marks the beginning of my day, and it makes me feel that every challenge that I'm going through is easier with coffee. Yeah, thank you.
Just name it as Coffee with Ayat, like we have in India, Coffee with Karan. So that would be a good name, interesting name, like Coffee with Ayat.
Yes, that's very true.
New season is coming up.
Sorry?
Nothing.
Yeah.
I just like new season is coming up. I just said.
Yeah, it's on 26th. Anybody else wants to answer this question? One. Anybody or we should shift to the next question. Like, if you are tell me about an incident where you had a conflict with your colleague. I think we have discussed that question as well, but somebody just wrote in a group that they want to discuss it. We can discuss it again. Right. Should we go with the next question, or somebody wants to answer this question? Okay, we'll then go with the next question. Yeah. Anybody wants to share an incident where they had a conflict with a colleague and how they overcame that? Like, anybody can go ahead with their answer, right? Anyone? Okay, Dr. Ayat, go ahead with your answer. Thank you.
Thank
Then
you.
I'll answer my. Go ahead.
Okay. So I think if I had a conflict with a colleague or with an attending, whatever, first of all, I will try to sit down with them and explain my point of view and understand their point of view, and then try to reach a solution. And I will explain to them that we are supposedly on the same team and we are on the same side. We are not enemies, or we are not on the each one of us is on a different side. We are both on the same side. And I would like to relate that to a situation that happened to me before. There was a patient that was scheduled for bone marrow aspiration, and after I got my stuff ready for the procedure and I entered room, I was surprised by a colleague that has already started the procedure. And then instead of fighting or commenting or whatsoever, I stood by them and I helped them through the procedure. And then later, I explained the situation and my conflict, or not my conflict, but my point of view. And she was so happy that I was there beside her and assisted her. And yes, that taught me that we should make the situation pass first, and that the patient care is the most important thing, and then everything else can be worked out. Thank you.
Okay, that's a very good answer. Anybody else wants to talk incident of a conflict with their friend? Or sorry, colleague?
So
Okay.
I want to
ahead.
answer.
Sure, go ahead.
Although I haven't faced any such situation yet, but I would respond it professionally if it happen in the future. Patient care is my first priority. So, in case of a conflict, I would have a private discussion with my colleague to understand the reason behind it. If we can't resolve it, I would seek advice from more experienced colleague. I would also reflect on my own actions and improve if I am a part of problem, because my primary focus remain ensuring the best care of my patients.
That's a very good answer. Like, that's fine. Everybody doesn't need to have a situation where they had a conflict with the colleague, but there are a very, very good way to answer. Yeah, Dr. Merlin, you asked something in the chat. You can go ahead with your answer. Like everybody can give their opinion after that. If you have anything in your mind.
Actually, I was asking, what if they asked about a specific incident? Because I'm trying to find an answer to this question myself, and I don't know with what situations should we mention and what shouldn't we mention, what can be taken to against us. So that's
So
my
like
problem.
Dr. Okay, that's as Dr. Merck answered like it professionally, like she didn't have any incident so far, but if she's going to have it in future, then she talked about how is she going to deal with that. So that's again like a very good way to answer that question. So in same way, if you don't have an incident, that's fine. Like it's not necessary everybody should have an incident where they had a fight with somebody, right? We are just few years into our profession. There's a long professional life ahead. At that time we might experience something, and we can just talk about how will we handle that situation at that time. Okay, anybody else wants to answer, like if they had ever a conflict with their colleague?
Thank you. I can go next.
Yeah, go ahead.
So during my work experience, I'm working as a medical assistant. So we get nursing students for training for certain hours at our clinic. So because they only learn the phlebotomy on the models, and this is the first time they have practical experience. So we have a policy in our office to do a blood test once on patient. If they're unable to do that, so they can ask for the help or they can call me because I can do those a test. But I was not aware of the situation. And the next day, the patient, she was around 50s, in her late 50s. She came and then she showed us a big bruise, like it's a very big bruise on her the cubital area. And when I asked one of the nursing students, so she mentioned that she poked her twice, and then she never mentioned it. So at that moment, I just let the moment pass because it was very unethical to do so because and like in late 60s when the patient's skin is fragile and they have tenderness soup and the patient was taking aspirin, maybe she can have a blood clot or something. So I was very scared at that moment. But at the end of the session, when they were about to leave, I just called her in a room and we talk about it. And then I told her, I know you are being very passionate about your profession and you wanted to practice and learn more. But just make sure if you had difficulty, I'm there to help you out. And there's no harm in asking me. I am here to teach you. So it's instead of harming or maybe providing discomfort to the patients, we should ask for help. And I was just same at the same situation just like you, I guess a year back, but I asked for the help from my colleagues. So in this way, from next onward, she always asks, she just give me a heads up, like, can you please just stand next to me in case I need you. So I was there for her, and this way we handle the situation, I think.
Perfect. Yeah, that shows like a lot of qualities about you, like your compassion, your empathy, even like towards your colleagues. So that's a very good example. Anybody else wants to answer this
Thank you.
question? Dr. Simi, do you have an answer to this question? Like you ever had a conflict with someone?
I would like to go next.
Go ahead, Dr. Priyansh.
What's going? So I've never had a conflict like this, but I've seen conflict with like some of the residents with the attending on the rounds or something like that. So what I felt is it matters what the conflict with whom the conflict is happening. Like it's very superior to you, you have to go through very respectfully. And I've seen residents being astute and blunt to the attending in front of the patients. So that's kind of a bad move. You should not do that. Like agree to it there, or maybe talk to them later. That would be another scenario where I've seen people being blunt is when they are talking someone inferior to them, like someone on the lower level. So where they don't even listen to the other people. So the first thing to conflict resolution should be listening to the other party, what they are saying, and understanding what they want to say. And after listening to them, if they are wrong, politely we can tell them that they are wrong, or how we can correct them, or how their thing can be changed, modified. That way, I think the conflict resolution should go instead of just being a blunt dictatorship. So,
Okay. Do you have like a particular incident where you want to talk about?
so once I was in the rounds, and there was this resident and the attending, they were rounding in the cardio rotation, and the resident, like in front of the patient, he told the attending that his treatment option was wrong, absolutely wrong, and he like claimed that the guidelines suggest like this in front of the patient, that you are wrong. So at that point, I felt like he should not have done that, because we are all people, everyone can make some kind of mistake. So that's what I felt that point. I didn't have anything personally. I never did involved in this kind of conflict incident.
Okay. Yeah. Okay, that's a very, very good answer. Yeah. Okay. Perfect. Yeah. So should I go with my answer? Anybody else wants to answer this question? Yes, Dr. Samyukta, you can go ahead with your answer.
Guys, I just joined. What is the question?
Oh, hi, Dr. Samyukta. Yeah. So you were badly missed. So the question is that if you ever had a conflict with your colleague and how you dealt with that.
Okay, yes, I do have an answer for this. So when I was doing my residency in obstetrics and gynecology, on one particular night shift, we had to do an outlet forceps delivery for a patient, and one of my juniors was scrubbing in for the procedure. So what happened was, I was supervising her, and her direction of using the outlet forceps was wrong. So I guided her that I guided her to do it correctly. But apparently she didn't take it very well. And once the whole procedure was done, and we took care of the patient and all that, I tried to, after we got back to the duty room, I tried to show her some images of the procedure, and I tried to explain to her that this is the way you have to do it. Soon after that, I think the next day, she happened to complain to the attending about it, that this is what happened. And then the attending called me, and I was like, I told her, I mean, she was good enough to give me her ear. So I told her my part of it as to why I had to speak up, because patient care is what patient care supersedes everything else, and that's the reason I had to correct her in front of the patient. So my attending just smiled and she let it go. But what I learned from this incident of getting into a conflict with my with my colleague was that next time when I supervise my juniors, I should discuss the procedure with them before they scrub in, instead of instead of leaving it till the end point where I have to correct them in front of the patient. So yeah, this is one instance where I ran into a conflict with my colleague and with my junior, and I realized what my mistake was, and I corrected it from there on.
That's a very good example. Yeah, that's a very good answer. Yeah. So anybody else wants to answer? Okay, I'll just go with my answer. I have answered a similar question like in a previous meet as well, but I'll take it user as an opportunity to talk about that again and improve my communication skills. So yeah, so that's a very interesting question. So I can recall an incident when I had a conflict with one of my colleagues. I was working in a private hospital in my city, and I was in the morning shift, and we just give a while leaving the duty, we have to we just maintain a register where we mention about patients, their diagnosis, and what treatment what treatment is to be given in the evening shift as well, or any orders by the consultant. So at that day, there was a patient with a headache, and the consultant neurologist ordered a CT scan, and I was on and it was my duty was going to end soon. So at that time, I just noted that in the register, and while talking to the colleague from the next duty, I mentioned about the CT scan has to be done, and the consulting neurologist needs it the next day. But when I come next day, the consultant neurologist is very furious at me that the CT scan has not been done. So at that time, I was a little, I, I just felt bad, and I just had a one-to-one conversation with my colleague that why her when I had told you to get her CT scan done, I mentioned that why didn't you get her CT scan done? And at that time, we had a little argument with each other. But then later on, she told me that I haven't mentioned that on the register. I might have given a verbal order, but I didn't specifically mention in about the order in the. I haven't written about the order in the register, and it was the patient load was very high the previous day, so that's why she might have missed it, right? And at that time, I just checked the register and I didn't write the order over there. So I just realized my mistake. I acknowledged it, and I then apologized to my colleague. And then we and after that we made sure that we can just write the orders separately as well, so that we don't miss anything, and we can just contribute our best towards our patient. So yeah, that's I think whenever there's a conflict with our colleagues, the first thing is first we should reflect upon ourselves, and if we have done any mistake, we should accept it and apologize for that. And I think 90% of the times the conflict will be over. And yeah, and after that we are good friends. So yeah, that was my incident when I had a conflict with my colleague, and that's what I learned from it. Yeah. So that's it. Anybody else? Then we can shift to the third question. It's already
Ayushman, I
9.
just have a quick question for you, if you don't mind.
Sure,
You
go
said
ahead.
that you had a discussion with the consultant. So I think just don't mention him. Just say that it was like a group of people who were being assigned to it, and then you and your friend or somebody had like decided to do the CT scan. So you trusted him, but he didn't do it, and in this way it missed. Like, don't talk about the other high authorities. Just talk about like it is between you and your colleague that you guys miscommunicate. I think that would be much easier, and because it doesn't it
it was between yeah, actually it's between both of us only. Like I was like we had a little bit argument, then I realized when I checked the register, I later on realized I haven't mentioned right. So then I just
Okay,
first
so it is
I
between you
apologized to her.
and your okay. No, I
My
was
friend,
thinking
yeah.
maybe you had a
So that's how
discussion with your consultant, and then okay, now that should be fine. Yeah,
the thing
just
was that I just immediately apologized. The things de-escalated again, and we were back to normal.
Okay.
So it was like what I learned was that I should first reflect upon myself, and if I have committed a mistake, I should accept it and apologize for that. Okay,
Yeah,
so
yeah.
that was
Between
like
colleagues
how
is
I
fine. Yeah, I was
overcame
thinking
that.
maybe you and your doctor. Okay. Yeah, perfect.
No, that would be like yeah. Thank you so much.
Yeah, I'm
Anybody else
sorry. I
wants to
just
answer?
misunderstood.
Oh, that's fine. That's fine. Anybody else wants to answer this question?
Hey Ayushman, I had just a random thought about some variation of this question, which could come as like you could be asked for what are your ways of conflict prevention, or what would you do for a conflict prevention as a program director. You are a program director and you want to prevent, like as a prophylactic mode, what would you do as a conflict prevention technique? Or so I think that would be a good thing to brainstorm.
Yeah, that's again a very good question. Apart from that, one more question that I had in my mind is that what quality do you don't want to see in your colleague? What would be that quality? Like that was another question, and one question that you told that like what measures would you take in your residency program so there is less conflict within the colleagues? So that's again a very good question. Yeah, we can just take it maybe tomorrow.
Yeah.
Yeah, that's a good question. Anybody else wants to answer this conflict with the colleague? I think Dr. Tenzin just wrote in the chat box, Dr. Tamanna. Yeah, sorry. So I think like we have a recording for this. You can just go over the recording because it would be hard for us to repeat our examples again.
Hi, Gupta. So I don't have example, but I just had one thought, and it may be helpful. What I believe that whatever stories we are sharing, whatever examples we are sharing, that should be very concise as much we can. Even we have to write the notes on our end, because if the story little get longer, I think we all lose the focus. So just a thought. Yeah.
That's a very good point. Yeah, I'll just, yeah, we have to work on our questions as well, so we don't keep on just speaking for the whole interview just one question. Yeah, we definitely need to work on our answers as well and speak it in a concise manner. Yeah, Dr. Busha, do you want to go ahead with your answer?
Yes. Actually, when I want to need your feedback whether I use it or not. Actually, when I was in my internship, there used to be a resident. She was very toxic. She used to interfere in everybody's matter. When I used to ask her some question regarding to patient or something like that, she used to give the answer in very ridiculous way. And when I was talking to some other residents, she used to interfere and used to give some toxic kind of answer, ridiculate me. But I never used to answer back her. But my fellow interns were same. They don't used to answer back her during the first month, but after the first month, they were kind of their threshold level reached. So they used to answer back her, but I never. So when the rotation ended, she apologized to me. So can I use that example? She has some kind of superiority complex. She used to do with every intern.
And
She used to interfere
hey,
their matter and
Dr. Bushra, I mean,
With us, yeah, Dr. Go ahead. Like, if you do you want to add anything, go ahead. Yeah.
sorry, I just want to add one point, buddy. I mean, we all are
Go
friends
ahead,
here.
Dr.
So, I'm not expert, and definitely, but what I feel I'm sharing. What I feel like we should not be using. We should try our best to not use negative words in our. For example, you are using toxic, for using superiority complex. Our whole conversation should be about positive words or expressing some concern in a better usage of words. The negative words, whenever they come in the conversation, it takes our mind towards the negative side. So no matter, even you're mentioning a challenge, you should say, you can use the word challenge. So
like the conflict or the situation in a professional way. So how's that for answer? Is that in conflict or like?
Did you say that you had to take his permission or he expected you to take his permission to do
No,
the procedure?
since he was posted there, I didn't notify him that I was going to perform the procedure. I went ahead and did the procedure. So technically, we didn't have to, since when we were posted in the same department, we didn't have to notify them. But since I was I was an intern from the other department, and I went to the internal medicine department to perform the procedure. I didn't notify him, so that made him upset. That's what I meant.
Okay. Yeah, that can be a conflict. That can be a conflict.
Thank you.
So we'll go with Dr. Amrit. Like Dr. Samyukta and Dr. Om, like we just started with the question, like what would you name your biography? So I think you guys joined late, and we just need a word for that. You can even answer after like we finish this question before moving to the next one. Like what would you name your biography as? Yeah, so Dr. Amrit, go ahead with your answer.
Thank you, doctor. It is a particular incident I remember while I was posted in the emergency department as a house officer. It was a particular day on a public holiday when I had to go to the duty with my two other colleagues. And just before the day when I had to go to the duty, I had an urgent work at one of my relatives and I had to take leave. So I informed the duty in charge and I took the leave and the leave was granted. But I forgot to inform that I was on leave to my colleagues. So on the duty day, since I was absent on the duty, they had higher workload and they had to do more work. So when I joined them on the next day, and they were upset with me that if I had informed them earlier, they would have found a replacement for me and the work would have been easier. And I realized that I should have informed them, and I apologized to them. And since then, I had been, since then, if I had to take a leave, I would inform to the duty in charge and as well as my colleagues as well, so that there would be no any miscommunication. Thank you.
Yeah. So, like, anybody else wants to answer? Like, you can just give your feedback in the chat box.
I just wanted to mention that, like, what the doctor just mentioned, that's not technically a conflict. It was a mistake on his part that he apologized for and he corrected, but that's not exactly a conflict. That's what my thoughts are.
Like, I think the example even I mentioned is not a conflict, that's a mistake on my part. So, like, if I want to quote that example, I would just start with, I don't know if exactly it's a conflict, but yeah, it was a mistake from my part, on my part, and then I learned from that, and then I can come up with the incident, unless and until I can just think about a better answer to that. Yeah. So, Dr. Om, like, do you have any word for your biography?
I really don't actually. Haven't like given that enough thought. I've been like busy a couple of days, so I don't think I have an answer for that yet. If I do come up with it at some point, I'll let you know. But sorry, I really don't have one right now.
Okay, that's fine. Like, Dr. Samyukta, do you have an answer to that?
Yeah, about what should be the title of my biography, right?
Yeah.
I would the title of my biography would be An Open Book. I've seen a lot in my life. I've been through a lot, but I have been pretty open in sharing about my past. So, because I feel it's always best to be honest and transparent in life, and that's why I would title my biography as An Open Book.
Oh, perfect. Yeah. So, like, should we move to the next question? Like, what would you prefer in your life, love or success? Anybody wants to just start answering with that question?
I'm sorry, could you please repeat the question one more time?
The question is, what, like, if they ask you, it's like a behavior, like, what would you like? What do you think is more important, love or success?
Okay.
Go ahead with your answer, Dr.
To me, there is first needs to, I mean, if I got asked, probably I'll ask, it depends what's the definition of these two words, right? So, love, if I see success as a profession, like my medical career, and if I see love as love for my family, honestly, I feel love is more important. And I myself is an example. Actually, I'm a senior graduate and I went through struggles after coming to US. And during that time, actually, my family needed me to go through different routes, and I went through it, and I'm proud of it today, what I did. And then after that, I'm focusing back on my medical career, which is, if I see as a success, the definition of success. So in that case, love is more important to me.
That's a good answer. Yeah. Anybody else? Love or success? What is more important to you?
My answer also would be that for me, what is more important is love. My reason is I cannot enjoy success without love. Be it anything, I mean, be it professionally, be it personally. I can't enjoy success which is earned by compulsion or by materialistic, what do you say? How should I put it? I don't know. But yes, this is what I would say. I cannot enjoy success without love. For me, love would come first.
Okay, that's a good answer. Yeah, Dr. Amrit, do you have an answer to this question? You raised your hands. Yeah. Anybody like, yeah, Dr. Sameer, you can go ahead with your answer.
Right now, currently the phase I'm in, I would choose success because all the love I want, I already get it from my friends and family. So I would right now I'd go for success. That is more priority for me.
Uh,
Perfect.
I would like to put a point here. So,
Yeah, yeah, go ahead, please.
speaking.
Dr. Priyansh,
Can we just say like we can strike a balance between both of them because both of them are important?
but that's what the question is. They want to know, like, they want to know your opinion. Your answer can be on both, but they just want to know your opinion. Why one of them or why both of them? You just need to have a reason to that.
Oh, I mean, we can say like love gives you like personal fulfillment, emotional support, and success like give you a sense of accomplishment and some like material security. So a balance between both of them is really important. How about this answer?
That's a very nice answer. I like it. Yeah.
That's a good answer, but yeah, that's a very convenient answer as well. Like, if everybody starts saying like both of them is important, we know both of them is important. You need love and success at the same time, but they want to know one answer and a reason with that. So it will be better if you answer the, a single term, like come up with a single answer, then come up with a reason. Like that's what I think. Otherwise, it's like I'm also very inexperienced in this, so I'm that's just my opinion.
I would
Yeah,
like to
he
put
can
an
he can
opinion.
he can emphasize on one, but he also used the word balance. That's also a good ending. Yeah. Balance of both. Yeah.
Yeah. Oh, yeah, Dr. Priyansh, you were saying something. Go ahead.
So,
Then we'll take
so
Dr.
for this
Usman.
question, love and success, what is important? I would, in any phase of my life, I would never say success over love. But what I would like to say is, I would also not say love over success. But I would like to say is personal growth over love over success. Because without personal growth, you are not loving yourself. If you're not growing personally, you are not loving yourself. That's the first important thing for me, that you love yourself. And then comes the love, and then you can be successful. Because if you are growing personally and you have love, you are already successful, in my opinion.
Perfect. Yeah. Okay, that's a good answer. Yeah, Dr. Usman, go ahead with your answer.
I will go with success because with success, a person wins power and fear, and as a result, as a bonus, love as a bonus. I mean.
Perfect. Yeah, Dr. Ashish, go ahead with your answer.
Yes, thank you. It's tough to choose between love and success because currently I'm in this phase of the life where I'm thriving to get success, to get into the residency position. But at the same time, the feat that I have achieved today is from my family's and friends' love and support continuously throughout my journey, throughout my hardship. So if I were to choose, I'd choose love because with their support, I believe I can achieve any success or achieve any of my goals. So I'd go with love. Yeah, definitely.
Oh, perfect. Yeah. Dr. Muhammad, you can go ahead with your answer.
Thank you. If I had to choose between love and success, I'll choose success because I believe that success requires sacrifice, requires commitment, requires some work ethics that will ultimately lead to love. So I believe that love can be an outcome of a successful person.
Can I make a small statement here? I mean,
Go ahead. Yeah.
what I want to say is when we say love, it does not necessarily have to be love of a person. See,
Of your family.
On the professional front, no, not just family person. It's love is also for your field. Unless you love what you do, you can never do it. And you can never be successful at it. If you have to go for your residency every morning because you have to go or because you're forced to go, then that wouldn't last long. So just food for thought. I mean, when we say love, I feel we should broaden the umbrella there. It's not just love of people, but it is also love for what you do. That's it.
yeah, that's a very good answer. Yeah, thank you so much.
Can I answer this question?
Go ahead, Dr. Alia.
Okay, I believe that there is no contradiction between love and success. I believe that love is a fuel and it ignites you to achieve success. If you love your job, you will do your best to achieve your success in this job. And if you love your family and your beloved ones, you will do your best to let them very proud of you and to be always there for them. So I believe without love, you cannot achieve success. If you love your job, you will do your best to succeed in it. So if I'll put something in order, I'll put love first, then you will definitely achieve success.
Right. That's a very good answer. Yeah. Anybody else? Dr. Priyansh, go ahead with your answer.
I would like to put a little bit different perspective for this thing. Like it is similar to what Dr. Ismail said. Love, you can consider success as an endpoint or a destiny, while love can be the journey. So if you want to reach success or you want to reach a destiny, you need to go through the journey, or you need either it's a love for the field or it's a love of your loved ones or anything. So that can be a perspective we can see.
Anybody else? Dr. Om, do you have an answer to this question?
Again, I really don't like have much this thing. I'm just listening to other people's answers for today. I'm sorry. I will keep thinking about this. If I come up with something, I'll let you know.
Okay, perfect. Yeah, Dr. Harshita, you want to give the answer? Go ahead.
Yeah, I think for me, love is more important because success comes and goes. Like no one person is always have failures too. So yeah, so love is more, and I mean, of course, like people would love you like irrespective of your successes and failures. I think that's why I think that's more important for me.
Oh, perfect. Yeah. Anybody else wants to answer this question, or I'll just even answer this question?
Yeah.
Like what I have in my mind is, so yesterday, yeah, go ahead, Dr. Sling. Yeah, go ahead first.
No, Ayushman, you were starting it. Go ahead. I'll do next.
Okay.
Yeah.
So for me, that's a very interesting question. But for me, when I have to choose between love and success, I would go for love. Love from my family, my friends, or maybe my partner is like will be something that will make me happy, and that will just make me happy, and I'll be because of that, I will work hard and be able to be able to achieve whatever I want and become successful. And even my love for my work, love for my work will again help me to achieve whatever I want and make me successful at the end of the day. So first, and even if I don't become, even if I am not successful, that void will be filled by the love from my family, friends, and partner. So yeah, for me, the love is more important than success. So anybody else wants to answer this question?
Yeah, I can do that.
Go ahead, Doctor.
So mine is also similar to yours, kind of. So I also prefer love over success. Why? Because throughout my life, I think the way I grow is just because of the love of my family first, and then by coming here in United States, the love of my husband and my in-laws. It was just never ending, and I think with their support and love, I just see myself growing further. And even if we are not talking about this particular like a field or maybe a residency, I still see myself thriving in another field of medicine, or maybe another profession, because that is much because success is temporary. If you have love, you can succeed anything. You can touch the moon, you can do anything. There's no end, there's no limit. It's like an infinity, or it's just like it's just a wide I think what I can say, it's just something special I can talk about it. I cannot even think about something else. It is the only thing I can think whenever I talk about it. It's just like the love and support of my family. Your mic is mute.
So I I was just saying that, it shows that, you have a lot of support from your husband, your family. That's again a good point for you.
Yeah, thank you.
So anybody else wants to answer this?
So I would like to add something. I need a feedback on this statement.
Okay.
So can we say that love over success, like success can be an abstract quality? What is success? Success's definition is different for different people. It's a state of mind. A satisfied person would consider himself successful even before the residency. So what I would like is love over success, because love is a quality which is defined over life by your family, by your parents, love for your field. But success is what you consider success. That's what success is. So I want feedback on this. Can you say this or not?
That's fine. For me, it's fine. Anybody wants to add something to this? That's a good statement. My internet is very slow.
Yes, I can.
Go ahead, Dr. Michael.
Okay, I go with love, because without love you don't do success, and without love you don't feel your success. As if you success without anyone love you, you don't feel anything about this success. And without support of your family, your friends, and surrounding you, it's nothing. Success without people, without the surrounding, is nothing for me.
There's a problem with my internet today, so your voice is breaking on my side. So I apologize for that. So that's why I can hear your whole answer. Anybody wants to give anybody wants to give the answer to the same question? Anybody else?
Yes, can I try, doctor?
Sure, go ahead.
Yes, to answering this question, I can tell love is essential for the life, and the success is a consequence or outcome of that love. So I can see this because I started my journey in US here, and after I was working overseas. So without my family and my husband and my friends' love, I couldn't do this and go to this journey. And also, I can remember that day when my 5 years old son, he's telling me that, Mom, I believe on you and you can do that, actually. And this is made the change for my life.
Perfect. That's a very good answer. Yeah. Anybody else? Or Dr. Akbar, you can even come up with your answer. Tell me about yourself. You can say anyone, whatever you have in your mind. Okay. Anybody else wants to answer this question? Between love and success, what would you choose?
I think there's agreement on that love is more important than success, or that we should choose love.
So do you have anything to add, to the answer? Why love over success?
It's love, I guess, because love gives you support and motivation to move forward and seek new goals and achieve them. And eventually it's going to lead to success.
Okay.
So in summary, if success is a machine, love is a tool.
Right. Okay. So anybody else, or we have taken 3 questions today. We will just take three new questions tomorrow. You can just post in the group whatever you want to, whatever questions you want to take tomorrow. Yeah. Dr. Akbar, you were telling about, you wanted to discuss about, tell me about yourself. Anybody else wants to discuss about any other question, or should I end the meeting? Like we are still like 1 hour 28 minutes into the meet. Any question you have, you can go ahead. Yeah.
Yeah. There's a question about like if you have encountered like an angry patient, what would you do? Like, or what should I say in such question if I do not have the experience or if I have not encountered any angry patients?
Okay. Anybody wants to answer about like if you ever had an encounter with angry patients? Yeah, go ahead, Dr.
Yeah, so the thing is, like, I thought about this, and the answer that I would give is first, try to empathize with the patient, and like basically, like in first step is building a rapport with them, and how you do that is by first things first, asking, trying to figure out why they're angry. Is it because of lack of is it because something that happened that day? Is it something anyway related to our work? Or the hospital or where we're working, or is it because of like whatever it is. Basically try to figure out in a calm and like non-judgmental way why the patient is angry, and then proceed from there. I think that would be like the core of what my answer would be.
Perfect. Thanks so much. I also mean like if I do not have a specific scenario for it, so I just tell them like I have not encountered such an
Sorry, please go ahead.
So I would tell them that I have not encountered such a situation or an experience, but in case I were to be faced with an angry patient, I'm gonna do this and this and this. Is that what you mean?
Not really. I don't think you need to have like a specific example, just like a general approach, general statement on like, answer on like how you would approach the situation would be the best way to go about this. Basically, that's what, if I were to encounter an angry patient, I would speak to them in a calm manner, and I would take the time, I would spend the next few minutes trying to figure out why they're like angry, or what exactly is like bothering them.
Perfect.
Yeah, so that's it.
Thank you.
So I would like to say that if a patient you think is angry from like you or the doctors per se, taking yourself out of the equation would be the best way to de-escalation, because I have done that a lot of times and that works. But if the patient is in general angry because of the pathology of the disease or something, then what you should do, what I feel like you should do, is first save your own self first, have some protection, or have a chaperone with you, and then proceed with the de-escalation and
everything. So, what would be like, for example, what would be the context of an angry patient? Like, like a doctor was.
Yeah, I am. Sorry, Dr. Mohammed. The thing. So I think that there's like a slight distinction to be made here. There are two things. One is an angry patient, a patient who's just like a little irritated, or who's answering in like a negative, like in a sort of harsh tone or whatever. And then there's an aggressive patient, right? In an with an either ways, I will like evaluate the situation, and then I will like deploy, like how do I put it, like go through hospital protocol to deal with like this thing, to call like maybe like security to because it's like, if I think in like step 2 also there's actually like a note on that, you kind of face yourself away from the door or something. You position yourself as close to the exit as possible, so that like you can leave whenever you need to, something like that. It's there. So that is an aggressive patient. But yeah, I would constantly evaluate the situation, talk to them, trying to figure out exactly what this thing is, while keeping my own safety and the safety of my co-workers and like colleagues in mind.
Perfect.
So
Perfect.
That is the answer.
Thank you so much.
No worries.
It's not like, even it's apart from the pathology, the patient is aggressive, apart from the pathology, it won't be like, it won't sound good that I won't be involved with that patient. I'll just leave that patient. Like, it's even if it's some because of like he got his treatment late, it's not your fault. But yeah, we need to have a word with the patient and acknowledge it, and just reassure them that they will. I can just talk to the authorities, or I can take up with that specific person. Like, they don't want to listen, that we'll just get out of that situation because it's not related to a medical thing of like, it's not related to pathology, or it's not related to me. That's like Dr. Om said, like these were the situations even in the step exams as well. So they want us to acknowledge the situation and apologize for that on the behalf of that person.
Great. Thank you,
Yes,
guys. Also,
exactly.
yeah,
Like,
just
I think step 2 has these like outlines that like the notes have these like how do I put it? They've outlined like what you need to say and stuff like that. So I think like you can go by that. Like for example, like if this thing just apologize without placing blame on anyone. Um, apologize first without placing the blame on anyone. Address the patient's like concerns. Exactly. Again, going back to talking to them, figuring out what specifically is like causing them to be angry, and while keeping again your safety and this thing in mind, and like keeping like hospital protocols regarding the safety of the patients and the safety of yourself, your colleagues, and the patient in mind. So that would be like the answer that I would give.
Yeah. So the order
great.
should be talk, acknowledge, and apologize. That's what they want us to do, right? And that's what step 1 and step 2 both tell us to talk, like have open-ended conversation, acknowledge it, and then just apologize for it.
And also, there's another question about like if someone tells you, if they ask you like, tell me about an interesting case, how many cases should we present? And when it comes to the presentation itself, should we go in detail, or we just like give them a background? Then the workup was like this, and my assessment was this, and the follow-up results resulted in this. How do you guys approach this question?
Again, this thing would be, I don't think like I would give multiple cases. I think I would just give the one, and I would oh, sorry. Yeah. I would I would talk about the first case, and why I found like what the basic, like just basic details. How do I put it? There's a balance to answering that question without like rambling on and like getting into too much into the specifics. So I think that's something you would have to like practice, run it through a few other people and stuff like that. But overall, talk about this thing, what you found interesting in it, and then I think I would end with more about what you did, in the sense of like, did you go and study up on that topic a little bit more? Did you like ask maybe someone that like ask the physician in charge if you could do like a case presentation on it, or like present it as like a poster or whatever it is. So something like that, more like I would focus more on like me and what I did.
Yeah, so like for example, I'm gonna tell you my example. Like, so we would start, okay, patient, like 75-year-old female or whatever, past medical history. She had a past medical history of this and this and this. She presented to the emergency department regarding the HPI. Like, should I go in detail what the acute onset course, what happened over the course of the hospitalization, the medication she received and stuff, or I should jump like right away to the assessment and the plan?
So I get what you're asking. Again, that's the thing that I wanted. Like I want to do this thing, in the sense that it is it is sort of like an art, if you want to call it that, because you do want to like explain. You don't want to say there was an interesting case about so and so and then just leave it at that. But at the same time, this thing. So this to answer what you're asking, I would like frame an answer first, and then tell it to someone, and then see how long it is, whether it's too long, too short, and then adjust accordingly. Like, it's not about at this point, I don't think it's more about details, it's about time, right? Like, you need to give just enough to explain what they're talking about. At the same you need to give just enough details, like for them to be interested and to know what you're talking about, while at the same time what do you call it? Like, well, not being too long, basically.
So what would be the ideal time for answering this question? Like how many minutes would you allocate to the question of presenting a case?
I don't know, maybe like 90 seconds to 2 minutes. Again, the thing is, you would be better off asking someone who's had actual like interview experience. I'm sorry if like, we're not like being like super very helpful here, but again, this is the kind of like, these are the kind of questions like we can here discuss, stuff about content and like whether something is like correct or like good or bad. But like with regards to like details and like this thing, I think it varies. Like, some interviews are like shorter, some interviews are longer, and like you would be better off like asking this to someone who's already gone through an interview or who is an interviewer or something like that to figure it out. I think that would be best for you.
Yeah, makes sense. I think it seems to be like I'll be the one who is gonna tell you this answer after the interview.
Absolutely. Please
We'll
do.
be in touch. Absolutely.
Yeah, that's it. If you have any more questions, please feel free to ask.
Thank you so much. I appreciate it.
So we are 1 hour 40 minutes in the meeting. So I think I'll end the meet right now, as I think people are leaving as well. So we can tomorrow take the interesting questions as well. How you discuss this? Have you discussed? Yeah, we have discussed this before as well. Yeah, and at that time, Dr. Om even gave a very good example, like the conflict he had.
Yeah. I mean, I didn't mention it today because I already mentioned it in the last meeting. I wanted to mention it again once more if this topic ever came up, because like, I realized I had like a lot of like refining to do on that answer. But yeah, basically the general gist was that, I was in during my OBGYN posting, I had a, what do you call it? I was in a situation where we were doing it was our team's like OT, day to perform surgeries in the operation theater. And me and a friend of mine were assigned as the day shift and night shift post-op duties. And someone had to be assigned to the ICU. Because we had a patient, but since it happened so rarely, we didn't have a such schedule, and it was up to the team of interns to decide like who has to go. And someone I was gonna say that a friend of mine, who what do you call it? Like they wanted to go, but sorry, they didn't want to go. They wanted me to cover for them, and despite me saying that like I am already on duty and I can't cover for them, they need to come and do it. They refused, and at that point, like I had to escalate it to like my resident, who then escalated it to the attending physician, and then the attending physician addressed it and like took care of it. And like my takeaway from that was that after a certain point, there's only so much you can do, and like what do you call it? There's only so much you can do, and you need to. It taught me this thing to how to address, like observe a situation and analyze it better to see where I can handle it myself, and when I need to like escalate it, when it's beyond my hands, and like when do I need to escalate it. So yeah, that was my example that I gave in the last meeting.
That's a very good example as always.
Thank you.
So yeah, so like whatever questions you have so far, like even it's a repeat question, you can just post in a group and we can take it tomorrow, because everybody joins, new people are joining the meeting. We can just listen to your answers as well, and you can get the feedback from everyone. Right, so feel free to post in the group and we can take it tomorrow. Like this question, like conflict with the colleague, we already discussed it once or twice, but there's no problem repeating the questions, because it gives us a chance to speak and improve ourselves. So just post in the group that you want to discuss these questions and we can take up in the meeting. Yeah.
Okay, perfect.
So I'll be ending. Yeah, go ahead, Doctor.
Yeah, I'm sorry. Just one last question. Have you come across that question that says like, what would you do if you like see your colleague or your workmate, he's snorting cocaine in a nightclub? How have you seen this question? I'm sorry, like I don't know if you guys have time.
I think I have.
Yeah. So what would be the best approach to this? Like,
step question. Yeah.
I have seen this question. I thought it was a really interesting one when I saw it. The thing is, what I would do is the first thing I would mention the fact that like what my colleagues do on their own time is their business. But at the same time, I would address it and I would like keep a close eye on him to make sure that like his habits do not affect his work in the hospital, whether they drink or like they smoke weed or smoke marijuana or they snort cocaine, whatever. Those recreational activities are on them, and like it's their personal life, and I don't believe it's my place to like interfere with that. But in a situation where it starts to affect their work and their behavior in the hospital, then I will like address it. Then I will like talk to them, and my first thing would be to like bring it up to them. In fact, let them know that like this thing that their behaviors are like these habits are like interfering with their work, and try to like help them. Maybe like if they confide in me that they have an addiction and they'd like to get over it, then I would like help them try as best I can. If they don't listen to me, or like if they're not like responding and like their work is continuing to get affected, then I would escalate the situation to the staff and like the chief of staff. Like I know that's a government term, but like whatever the term is for like in the hospital, like the people, the person
The
responsible.
seniors.
Yeah. Basically, I would
That's a
escalate it to them, let them handle it. So yeah.
that's a great approach. Yeah, that's a very nice answer, especially the first part you said that what everyone does outside work, it's not our business. It's their life, and we should
Exactly.
respect that. Yeah,
Right?
thank
Like
you.
there are
I would have
professional and
said that.
personal boundaries, and that boundary, like for me, it's when their performance in the hospital, like at work gets affected.
That's perfect answer. That's a very, very nice answer.
Perfect.
Awesome.
So I think I'll end the meet now. So and tomorrow we can just post some new questions you have. So Dr. Iyer is just talking about if it's somebody's doing it in their personal time, we cannot comment on that, right? But unless and until it's affecting their work, then we can take action. That's what the step questions even were. Like you see that patient presenting with the alcohol, like he just had alcohol and he's just here and treating the patients. So that's affecting his work. But unless and until it's not affecting, it's the personal choice. They smoke cocaine or like marijuana, anything they want to do, that's their personal choice.
Perfect.
That's a very
Thanks
good
so
point that
much,
Dr.
guys, for all of
mentioned.
these insights and the answer. It was really, really productive. Thank you. Thank you so much.
We'll meet tomorrow. Thank you so much, everyone, for joining, and have a good day or night ahead, depending on your time zones. And
Yeah.
see you
Have
tomorrow.
a great night. See you tomorrow. Bye bye.
Thanks, Ayushman.
Thank you, Ayushman.
Good. Bye bye.
Thank you so much.
Yeah. So I hope we can see you tomorrow as well. Yeah. Okay. So Dr. Surya just shared the recording in the group.